Hello everyone, in this video we will be discussing adrenergic antagonists. These drugs they bind to adrenergic receptors and prevent the activation of these receptors by endogenous catecholamines. And they are mostly used to treat diseases that are associated with the cardiovascular system. These adrenergic antagonists are divided into three groups. The first group are alpha-1 receptor blockers. These alpha-1 receptor blockers include non-selective ones which block alpha-1 and alpha-2 and selective ones which block only alpha-1 receptors. The non-selective ones are phenoxybenzamine and phentolamine. The selective one is prazosin and finasteride, and also we have yohimbine which is alpha-2 receptor blocker. The second group of these adrenergic antagonists are the beta receptor blockers. This group include propranolol, which is beta 1 and beta 2 receptor blocker like non-selective, and also we have timolol, nadolol, bindolol, acebutolol, labetalol, and carvedilol. The third group is the neurotransmitter release or neurotransmitter uptake blockers, and this group include reserpine, guanethidine, and cocaine. If we start with the non-selective alpha receptor blockers, and as we said before, it contains two drugs which are the phenoxybenzamine and phentolamine. Phenoxybenzamine is irreversible, like it binds to the adrenergic receptor and covalently, while phentolamine it binds to the receptor with reversible bond. And these drugs, because they block adrenergic receptors, especially the alpha-1 receptors, they will prevent the vasoconstriction of the peripheral blood vessels, and this will lead to and produce a reflex tachycardia. Most of these drugs they are used to treat pheochromocytoma, which is a condition that the adrenal glands produce a huge amount of epinephrine and norepinephrine. Also, they are used in hypertensive crisis. Now, the second group, which are the selective alpha-1 receptor blockers, include drugs like prazosin, terazosin, and doxazosin. And because they block also alpha-1 receptors, they will decrease the peripheral vascular resistance and they will also lower the arterial blood pressure. That's why they are mostly used to treat hypertension and also in congestive heart failure. While tamsulosin, alfuzosin, and finasteride and dutasteride, they inhibit especially the alpha-1A receptors, which are found on the prostate. That's why they are mainly indicated to treat benign prostate hypertrophy. The last agent of alpha receptor blockers is yohimbine, which is selective alpha-2 receptor blocker, and it works at the level of the CNS to increase the sympathetic outflow to the peripheral nervous system. And it is mainly used in Raynaud disease, which is a condition that decreases the blood flow to the fingers. This drug it is contraindicated to be used in central nervous and cardiovascular conditions because it is a stimulant. Coming to non-selective beta-adrenergic blockers, we will start with the non-selective ones, which are the propranolol, timolol, and nadolol. Propranolol, which blocks both beta-1 and beta-2 receptors, it decreases the cardiac output, which will lead to both negative inotropic and chronotropic effect. And it is mainly used in hypertension and angina pectoris, myocardial infarction, arrhythmias, migraine, and hyperthyroidism. While timolol, it is mainly used topically to treat glaucoma and sometimes systemically to treat hypertension. And nadolol is different from the previous ones because it has a very long duration of action. These drugs they are contraindicated to be used in patients with chronic obstructive pulmonary disease or asthma because they block beta-2 receptors which are found on the bronchial smooth muscles. While the selective beta-1 receptor blockers include metoprolol, ismolol, atenolol, nebivolol, bisoprolol, and finally betaxolol. These drugs they don't have the bronchoconstriction effect of the non-selective beta blockers because they only block beta 1 receptors, which are mainly found on the heart. And they are also mainly used to treat hypertensive patients, especially the ones which have an impaired pulmonary function and also the one who have diabetes. And other two medications in this group, the beta 1 receptor blockers group, is acebutolol and bindolol. These drugs they are separated from the other group because they have also partial agonist activity, which are called like to have intrinsic sympathomimetic activity. That's why they cannot be used in arrhythmia, and mostly they are used to treat hypertensive patients which have moderate bradycardia. And other beta blockers are labetalol and carvedilol, but these two drugs they also block alpha receptors. Labetalol is very useful to treat patients that are elderly or black hypertensive patients. It is also an alternative to methyl dopa to treat pregnancy-induced hypertension. It's also used in hypertensive emergencies, while carvedilol is used to prevent cardiovascular mortality in high heart failure patients. The last group is the drugs that affect norepinephrine release or reuptake, and it includes reserpine and guanethidine and cocaine. Reserpine blocks monoamines transport from the cytoplasm into storage vesicles. Monoamines are like norepinephrine, serotonin, dopamine, and also epinephrine. While guanethidine it blocks the release of stored norepinephrine, but this drug is not used because of its side effects. Lastly, cocaine it also blocks the reuptake of the monoamines. Thank you for watching.